Hello nurses, let's talk about the key points regarding antipsychotic drugs. Antipsychotic drugs are also known as the major tranquilizers, and it is divided into two categories. Okay, so first is the typical antipsychotic, which is also known as the traditional antipsychotic or the older antipsychotic drugs, and also the dopamine receptor blockers. Okay, and the next category is the atypical antipsychotic drugs, which is also known as the newer antipsychotic drugs or the non-traditional antipsychotic drugs. Now, the typical antipsychotic drugs are mostly used for the positive symptoms of schizophrenia, like your hallucination, delusions, the catatonic behaviors. Okay. Now, the most common side effect is the extrapyramidal symptoms for the typical antipsychotic drugs, and the metabolic symptoms are a less common side effect. Most common side effect for the atypical antipsychotic drugs is the metabolic symptoms, and less common is EPS. EPS means the extrapyramidal symptoms, like the patient can have dystonia, pseudo-Parkinsonism, then akathisia, that the patient feels restless, agitation, okay, and the dyskinesia, NMS, all are seen in case of the EPS. Now, the most commonly used typical antipsychotic drugs are here. Firstly, CPZ or the chlorpromazine, which is most potent typical antipsychotic drug, and CPZ is the drug of choice for schizophrenia, but there are some side effects of CPZ also, like the anticholinergic effects, okay, like dry mouth, dry tongue, constipation, dilated pupils, increased heart rate, then increased blood pressure, all can be seen in case of CPZ as side effect, and patient can also have corneal ulcer. Then haloperidol, here the most common side effect is the EPS. Then the thioridazone. So in case of thioridazone, the most common side effect is the QT prolongation. Okay, and then the patient can complain of the anticholinergic side effects and the corneal ulcer, mainly the retinal pigmentation. Retinal pigmentation becomes irreversible here. And the others typical antipsychotic drugs are the pimozide, then loxapine. Loxapine is used as nasal drops. Then the flufenazine and the trifluoperazine, prochlorpromazine, all are the example of the typical antipsychotic drugs, and the trifluoperazine is useful for the schizophrenia and for the anxiety disorders. When all the medicines failed in case of anxiety disorder, this medicine works well. Okay, now the atypical antipsychotic drugs, this is also known as the second generation drug. So atypical antipsychotic drugs, the most important are the olanzapine, clozapine, QT-pine and the risperidone. Here are some key points regarding clozapine. So clozapine is the most potent atypical antipsychotic drug in case of treatment of the resistant schizophrenia, but there are some side effects like sedation is the most common side effect, and the other side effect, here you can use the mnemonic, that is the SAM. S for seizure, A for agranulocytosis and M for myocarditis. So in case of seizure, the seizure is a most serious side effect, and it also dose dependent, like if the dose is increased in the patient, then the seizure will increase, and if the dose is decreased, so the seizure will also decrease. So what is the nursing responsibility here? So the primary nursing action of a patient having a seizure after having clozapine with increased dose, so first of all, prevent any kind of injury, then inform the healthcare professional or the on-call doctor as soon as possible, and decrease the dose of the clozapine. Okay, and then the agranulocytosis, that is the decreased number of the granulocytes of WBC, like all the basophils, monophils and the neutrophils. Okay, and then what is the myocarditis? Myocarditis, as you know, the inflammation of the myocardium, the middle layer of the heart, and the early sign is the chest pain. So in case a patient complains of chest pains after having this drug, okay, then you have to do ECG. So these are all the key points regarding the atypical antipsychotic drug. I hope it helps a little, so thank you everyone.